We had a very interesting morning, and we're going to continue with some equally interesting talks this afternoon. Please join me in welcoming our speakers for this afternoon, Andrew Wister and Melanie Levasseur from University of Sherbrooke. And I hope all of you have seen the full program. That should be, there should be a copy on your table. And inside, you will see that there are biographies for each of the speakers. And we do this quite deliberately because we didn't want to spend hours and hours talking about how terrific they are, and rather to get on with the program. So having said that, I want to call Andrew to begin the afternoon.
Good afternoon, everyone. So the Connect Age project is a 5-year Social Science Humanity Research Council Insight grant. It's 4, but they give you an extra year because they're so slow in providing the funding. The title of it is, it's a mouthful. Social Connectedness and Resilience Among Marginalized Older Adults and Caregivers, Co-Produced Intersectoral Knowledge Implemented with Community Organizations. I think we all prefer Connect Age. So there's quite a group on this team, a combination of academic researchers and community collaborators. And in fact, it's a really interesting project because it's one in which there's actually more community collaborators than the researchers themselves. My co-PI from Quebec is Melanie Levasseur, who's going to be speaking in just a moment after me. And fundamentally, there's 2 arms to this study. There's a BC arm and a Quebec arm to make comparisons because they're obviously unique provinces in many respects. But there's also commonalities across them, and there's going to be sharing of knowledge and resources that we develop. We have a large team. I'm going to run through the team very quickly. Laura Katawaki is an adjunct professor here in the Department of Gerontology, but also works for United Way. You heard her earlier. Loon Lai is assistant professor, School of Social Work at MacEwan University in Alberta. Ruth Najabi, assistant professor, School of Social Work, University of Sherbrooke. John Pickering, he's a postdoc fellow at SFU, no longer at GRC, but he also works for Fraser Health. Valérie Poulin, associate professor, Department of Occupational Therapy, University of Quebec. And Toa Rivera, and she's a researcher as well at the center there. Samuel Baudin, Gris Esther, Linain Dubé is president of FADUC. Daniel Ferrand is a senior citizen representative. Leslie Gaudette, president of Costco, who I'm sure many of you know already. Leslie's raising her hand. Kathleen Jameson is a senior citizen rep. Kahir Jalil was the provincial director of the Government Relations and Programs United Way, but has now moved to HelpAge, but he's still on the project. Sandra Gedhart, chair of Richmond Seniors Advisory Council. Anthony Cooperschmidt, strategic lead, Aging and Older Persons City of Vancouver. Stephanie Mayette and Mary Delaires, Valupsa and Valpusta and Julie Beadle are all postdocs working on this project. And the coordinators on the BC side are Boa Kim and Elise Stone. I know they're there. Maybe raise your hand, wave Boa and Elise. I know you're here. And on the Quebec side, Daniel Nod and Lawrence Couture. Sarah Key is the communication officer and our great organizer here. I don't know where she is. And I see Laura Katawaki's here too. Can you wave, Laura? And if there's anyone else who was here, wave. Thank you. Okay. So tremendous group. The Connect Age project came from an idea that I developed, and then I reached out to Melanie to be a co-PI, and the idea was to build on what was going on in the UK with their campaign to end loneliness. What they were doing there is there was a philanthropist from Greece, actually, who donated money so that there could be this kind of very big campaign to bring organizations together that serve older adults to address social isolation and loneliness. And so we want to do something similar, and that is we wanted to work on the organizational level. So we have about 80 seniors organizations participating in BC and Quebec. It was actually, it's building up to 80, and I think 40 in Quebec. We have 40 in BC. These are organizations such as senior centers, neighborhood houses, specialized groups like men's sheds, other groups provide pet care, and so on and so forth. Quite a spectrum of organizations. And we're also bringing in some of the overarching, what we call umbrella organizations, planning organizations that aren't supporting seniors directly in their organizations, but they are connecting senior centers together. So we quickly here, the kinds of resources, when I talk about resources that we're referring to, are things like grant support, scoping review translation, client record reviews, program reviews, volunteer enhancement, targeted CLSA data analysis, leveraging resources across organizations, just to name a few. So we did a baseline survey to start and got an idea about the challenges and needs and the programs, actually, that were engaged in by the 40 BC organizations, and Melanie will speak to the Quebec side in a few minutes. We then developed workshops, and we developed workshops for smaller clusters of organizations to make it more manageable, and we did 9 of these, the same workshops for 9 clusters. And I'll tell you a little bit about those clusters in a moment. But the idea of the workshops, this was an initial set of workshops, and then we're going to have a second set, and then a third, and then a fourth. So at each set of workshops, we build exchanges and resources and so forth. The idea is to enhance the programs and build new programs, innovative programs that address social isolation and loneliness, what I'll say SIL. I'll just use SIL for marginalized older adults. And then disseminate those findings to all organizations in BC and Quebec and maybe even further. So how do we define loneliness and social isolation and loneliness? Social isolation is a lack of the quality of social contacts, and loneliness, so that's more of an objective measure, so you can count number of contacts and the quality of those contacts. Loneliness, on the other hand, is defined as kind of the feelings that we get, the distressing feelings when there isn't good when there isn't good social participation. In fact, it's negative when there's social isolation. These are 2 overlapping ideas because one's more objective, one is subjective. However, there are times when you can have unique circumstances where an individual perhaps is very socially connected in a large apartment building, but feels lonely. And on the opposite, you can have people who want to be on their own, they're not socially connected, and don't feel lonely. They just want to be on their own. So you do get those kind of unique circumstances. We know that social isolation and loneliness, SIL, is an important medical issue. I think a lot of groups and professional groups and docs and so on and so forth will pay more attention when they see that it is a medical issue. And there's been strong associations shown between SIL and cardiovascular disease. It doubles the risk of mortality, and it significantly affects mental and functional health, and I don't have to convince all of you of these things. During the pandemic, many of these problems were exacerbated, weren't they? They became much worse. So, for example, if we look at some CLSA data, Canadian Longitudinal Study of Aging, which involves over 51,000 Canadians in 2010-2011 to start, aged 45 to 85, and we follow them every 3 years. We see 3 bars. Each bar is a different time period, so the light sort of pinkish, if you will, color is baseline, collected in 2011 to 2015. The first follow-up is the 2015 to 2018 data in red, and the burgundy is the COVID study. So this is the percentage of people reporting feeling lonely some of the time or most of the time. So it's crude, but it's useful for comparative purposes. And we see that the percentage spikes during the COVID survey. So for women 65 to 74 at the far end of this screen, you see that it's about 25% prior, in both surveys prior to COVID, but spiked up to 41%. That's a 17% absolute change. That's really huge. And then for men, similar increases, but for women, I think it's even a larger increase. For men, it was an 8% point change, 11% for women, 75 to 84, and men 75 to 84 increase as well. So we see that that's a major factor. There's a number of risk factors of SIL. It's kind of a kaleidoscope issue, and we see that some of these are kind of demographic or socioeconomic factors. Others are related to their living situation or other statuses that they may have. So advanced age, living alone, living with low income or in poverty, a lack of affordable housing, loss of sense of community, widowhood, episodic or lifelong physical mental health issues, including dementia and loss of various sensory motor abilities. Challenges related to technology, those living in rural remote areas, immigrant or ethnic or ethnocultural groups, indigenous elders, LGBTQ+, and caregivers with heavy burden, to name a few. This isn't exhaustive, but it gives you an idea of the range of risk factors. Some of these are modifiable. Some are non-modifiable. The ones that are modifiable, I think we'll probably give a little more attention to. So, resilience is the ability to rebound from adversity, and we really draw on the resilience concept, because what we want to do is work with organizations, see what their strengths are, and enhance the strengths. Yes, there'll be challenges and issues, but we want to enhance. So that's the resilience piece. My work has applied resilience to multimorbidity, to the pandemic stress and social isolation and the combination of those. But this particular grant and work was focusing mainly on SIL. There's a model that we've developed through a scoping review that's very close to being accepted for publication. And it's an integrated model of resilience, social isolation, and loneliness in old age. And the centerpiece of that, and I know it's a little bit busy, so bear with me for 1 second, and I don't want to, this isn't a theory course, but we do draw on this kind of work to frame the project. So in the middle, we see individual resilience processes. These are things that are affecting the person. So for example, we have at first adversity, the adversity being SIL, social isolation or loneliness or a combination thereof. The perception of that is very important, and then we have protective and preventive factors and mechanisms and motivations to activate those resources if they are present. And then, of course, adaptation and coping and emotional regulation is kind of individual kinds of ways of adapting or coping with stressors that relate to SIL, and then wellness, recovery, and sometimes growth. But the larger picture, and this is the piece that's really important for our project, is the structural or socio-ecological and environmental factors. So on the social ecological context side, it ranges from the individual to global, of course, but it does cover the home, neighborhood, municipality, and so forth. At the left-hand side, we see environmental resilience contexts. They range from the physical context, informational, cognitive, social. And at the top, we draw from the resilience system functions out of disaster research with colleagues that we've been working with in the United States. And there, they've identified through the National Academy of Sciences that being able to plan, absorb, recover, and adapt are the main facets to respond to various kinds of adversities, not just something like a pandemic or not just a hurricane and disaster research, but also SIL. And at the bottom, we have the life course experiences, biographies, and aging that take place. So this is just the framework around which we've applied this work and which helped to frame the project, as I mentioned earlier. So the participating organizations were put into clusters. So we had these clusters and then had workshops with each of the clusters. The clusters range between about 5 and 8 different organizations of similarity. So we have the coastal and island rural remote. So these are clusters were developed based on the size of the community and the type of the organization serving older adults. Then we had northern and interior rural and remote, smaller than 30K. Urban, suburban, between 30 and 100K. This is Stats Canada sizes that are used for designating categories of urban and rurality. Urban Core and Urban is another group, and then organizations serving visible minorities or ethnocultural groups. So these are the ones that we used. We had our first set of workshops, and we found out some very interesting things. We recorded them, and we created summaries of those, and in the process of developing papers from those summaries that can help identify the key challenges that organizations have in developing programs specific to SIL for older adults. We heard about things like their need for, and these are the things that we're developing. And by the way, we're putting these on a OneDrive system that will be accessed by those participating organizations. So this is at the organizational level. Managers or some high-level person of the organization are representing the organizations. These are the 40 people I'm alluding to. So an organizational directory they wanted so that they can speak to one another. Seems obvious. Some places have them, but they want it, so that's one thing we're doing. We created fact sheets on SIL. I'm not going to show you all of these, I just have a few snippets. And scoping reviews. There's over 30 scoping reviews that focus on SIL among older adults, but they're written in very academic language. So we've taken those, and our team, and I know that Boa and Jean-Paul we're working on this in particular, but and then in Quebec, their side, we're doing the same. And we've summarized them into lay language where they're usable. They could be usable for writing grants and for other uses, just for information. The workshop summaries are another thing that we're developing to provide, so all organizations can see what are the challenges that other organizations have. Oh, maybe we can learn from that, or maybe we'll group them together. Challenge areas, barriers, innovations, and solutions. What are some innovative programs? We've heard about meals programs to address SIL in some communities. All kinds of technologies being used and so on and so forth. We have summaries of annual surveys that we're conducting. We have grant support. So a lot of the organizations say, listen, we're spending an inordinate amount of time hustling to get small grant monies. Well, maybe have 10 of these that we have to produce every year for 1 year of funding. It's a great challenge for them. So we're providing support for their grants. We can't write them, but we're providing supports in various ways, and I'll give you an example of what those are in just a minute. Volunteer support is another area in the areas, so the recruitment, retention, and recognition of volunteers, fundamental to organizations, of any size. And the characteristics of volunteers are changing. COVID had a big effect. Yeah, a lot of people volunteered for a short period of time and then no longer. In the past, many volunteers were older adults. We're finding that the baby boomers who are aging have different skills, different interests of volunteering. So there's a whole different strategy we need there. We've developed, Elise has been leading this work, Elise Stone, on templates for client records. And these are templates for client surveys. So we'll have actual surveys. They're really nice surveys, and you can run them with your clients of an organization and get back information. We have them set up so they can add or take away questions. And then it's very easy. It produces the frequencies on those read like that. It's very, very user-friendly. So those are some of the things, among others. And also we're bringing organizations together to work in various groups. So some of the themes that came out of the workshops in terms of solutions and innovations, one was, and these are just a few, collaboration and sharing resources with other organizations. One person said, I think that when it comes to funding, if you as a single group go in and ask for money for a single thing, your chances are slim. However, if you collaborate with other groups, your chances increase. So we had that kind of discussion. So you might have some fundings opportunities that are restrictive to only organizations can apply who have a large catchment of seniors. Whereas if you join maybe 3 smaller organizations together, you can meet that criteria. Another theme is recruiting a diverse staff and volunteer team. If there's older adults in need of translation or multilingual support, our team can help. This person could speak 3 languages, including English, and their colleagues speak 4 or 5, and if they can't speak any of those, they have volunteers who can help. So that's another area very important. A third theme was volunteer opportunities, as I alluded to earlier. We, quote, we have probably close to 300 volunteers that we engage at many different levels. We're very senior-led in our programming, so we recognize that there are meaningful ways that our senior volunteers are involved. And we see that this is very purposeful work as well. But there are challenges as well with the recruitment of volunteers, as we heard. So here's an example of some of the resources, and we have quite, there's a lot more to it than what we're seeing here. Grant opportunities, we have a spreadsheet that we've created, led by Boa Kim and Julie Beadle, with others supporting, and we have about 20 grants, federal, provincial, municipal, that we have in the spreadsheet. We have the various criteria, their mandate, the deadlines, all the information, but really simple and not like having to wade through these websites to find all of this. So it's very user-friendly, so they can find out, what's the grant amount, what are the criteria, et cetera. And then our plan is to provide support for organizations to go after this funding, and this is going to be very hard for 40 to do 40, but not all of them need support. And some need support in one area, but not another. Now, we can't, as I said, write them, but we can provide various kinds of supports, like this kind of information that's very useful at the grant level. We also link to various other kinds of resources, application examples, information sessions. We'll have webinars. We'll have all kinds of supports that will provide these organizations. Then we'll have ongoing updates, and we'll continue. Of course, there's a lot of generic information that we provide on the OneDrive for the organizations, but then we can do some one-on-one as well. The volunteer resources, it's a bit tricky. I don't know if anybody knows this, but in BC, there isn't one provincial organization that supports volunteer recruitment, retention, and recognition. They have one in Quebec, and we're learning from them. There's Volunteer Canada, and you can go on Volunteer Canada website, and you can see there are some resources there that are useful, but they're fairly generic, and most aren't specific to community-based senior services. So we're putting together various materials in support of this, and we're developing a national volunteer action strategy based on Volunteer Canada, but we're adding to that. We're going to have volunteer connector websites, Better Impact volunteer connectors. We're going to, our work is going to specifically look at conducting literature reviews to create tools and resources that provide our partner organizations with the most up-to-date evidence-based information on volunteer. We can also provide posters. We can help write those posters and how you gain volunteers, and bring to bear all of the knowledge base that we can find, but in a very user-friendly fashion. People who are in these organizations do not have extra time. We have to make it simple but effective. Thank you.
Hello, everyone. Good afternoon. I'm thrilled to be here today. Thank you for the invite. It's always a pleasure to be in Vancouver. It seems that I bring with me the nice weather also, so I'm glad about that. So I'm Mélanie Levasseur. I'm from Quebec, and you already all noticed I'm French-speaking, but I will do my best to make myself understand. So it's a pleasure to work with Andrew and colleagues from Vancouver. And I'm thrilled to present the result from the Quebec side today. So I won't repeat what Andrew presented, but he did present both sides of the team, so even the French difficult name to pronounce. So I acknowledge him for that. So I basically built my presentations on 3 parts: why now, our goals, and the result of the Quebec side. So why now? Right now, we are facing a global aging of the population, and here you see that in 2020 that there were in Canada 24% of older adult age 60 and over, and in 2050 2050, it will be 32%. So there is an increase in the proportion of the population. And this goes along with, if you see in this graph, there is the curve of those age 65 and older are the more drastic raising curve, and the one under 25, under 15, under 5 are all decreasing curves. So this is particularly worrying in terms of demographic change. Also, Andrew talked about social isolation and loneliness. I won't repeat that, but I want to introduce social participation and connection. We are both working with those concepts, and social participation is defined as a person's involvement in activity providing interaction with others in community life, and it's also an important shared spaces, and it's evolving according to available time and resources. So that's why it's important to know better what is the resources available in a community of someone, but also what is the resources the person has, the personal resources. And it's based on societal context and what an individual wants and what is meaningful for them. So in terms of social participation, there is a decrease in social participation while normal aging, usually around 75 years of age. And this is worrying because it leads to social isolation and loneliness. So this is why we have to look how can we increase, yes, reduce isolation and loneliness, but increase social participation and connection. And the World Health Organization just a few years ago launched the WHO Commission on Social Connection. So there is a global movement toward increasing social connection. And our colleagues also developed a guideline in mental health of older adults. The Canadian Coalition for Mental Health of Older Adults developed a guideline to, and Andrew and I work on the team to really target how can we better equip professionals to do to evaluate social isolation and loneliness, but also to intervene and reach those older adults to decrease social isolation and loneliness. And when we look at the Canada portrait of social participation, we see that in Quebec there is a specific challenge. So the frequency of social activity are lower in terms of the number of activity per month that people in Quebec are doing to participate socially. So there is a need to increase that. So BC is less worrying in terms of frequency, and we updated that with using the Canadian Longitudinal Survey on aging data, and it's also worrying for Quebec in terms of frequency. So it's among the lowest frequency of social participation amongst other provinces. And when we ask them, do you want to participate more? There is also fewer people in Quebec that wish to participate more. So we have a double challenges in terms of increasing awareness about the importance of social participation. Also, community organizations are telling us it's difficult to reach individuals which are lonely and isolated. So how can we intervene if we don't reach them? So this really leads to the project that we are presenting today, and more globally, they call it a zero pandemic, which is we have to be careful of those terms because they carry ageism. But basically, the pandemic was really amplified isolation for older adult and caregiver. It also, the community organization have to adapt their services, so they were really on the edge in terms of rapidly changing their practice. But still, after the pandemic, these challenges remain. So they have, as Andrew mentioned, limited resources. Also in Quebec, difficulty reaching, especially the most vulnerable or marginalized older adult and caregiver. And also a challenge to translate research into practice. So our beautiful research language is not that easy to understand and apply to their practice. So there is really a need for effective intervention and also support from research on that. And this partially also lead to our research program on social participation and connection that we are working in my team. But basically it means that we are targeting all older adults, those who are from the general population who are doing well in terms of capacity. So creating more age-friendly environment, like Tina introduced this morning, but also inclusive environment, not only age-friendly, but also to rethink how we build the environment to have gathering places, for example. And also to help them to rethink how they're planning their retirement. So it's easy to fall into habits when you are retired, and these habits can be really sedentary and can be also with less meaningful activity. So that's why sometimes in occupational therapy, we help people to rethink their daily routine and their lifestyle. In terms of also assistance, we assist older adults to reintegrate into the community. There is already a huge services of volunteering that are doing some friendly visit, but how can we do better? How can we not only reach them and do friendly visit, but help them to reintegrate the community and the activity that are available in the community? So our goal in the project was basically to establish a collaborative research network to better define the challenge faced by community organizations that are reaching older adult marginalized and also caregiver, to develop evidence-based response for those organizations, how research can serve and help those organizations, and to co-produce and implemented some strategic innovation, best approach from elsewhere in the world, but also co-producing, co-developing based on what is available right now. We won't reinvent the wheel. We really want to help them to raise and go above in terms of what they are already doing that is wonderful, but how can we benefit more of this? So Andrew talked about cross-sectional survey, recruitment, some of the criteria. We did data extraction and analysis, so I won't go through that all again. And also in Quebec, we had the 91 organizations that we cluster a bit differently because they are not the same. So one cluster was about home support and autonomy. The second one was about advocacy, aid, and minority. A third one was on activity and pairing, and a fourth one was on caregiving support and governance. So we invited them and then do a workshop or a group interview and analyze the content. So we are right now, it's preliminary result. We are a bit behind BC in terms of timing, but here you see the characteristic of the 91 organizations. So it's basically 62 organizations offering general services, such as They rely mostly on volunteer, and they support older adults with disability, promote aging at home. They also offer individual pairing, group activity, transport for medical and leisure issue, and also food assistance, so Meals on Wheels, for example. We also have 29 community organizations offering really targeted services. So for caregiver, people having disability and non-visible minority. So organizations from both categories really have a mission to reach person at risk of marginalization. So and you see how the proportion of each organization on the slide, and I won't repeat that. But you can see that very few target caregivers for general services or non-visible minority, also for targeted services. So there is some gap in our resources. We also look at those organizations in terms of rurality. So basically, most of them were either in the urban or suburban areas, such as in Montreal, Quebec, and Sherbrooke. Some were also remote and low density, especially when we talk about more general services. When we look at target services, and I will show in the next slide how they map into Quebec geographic area. They were like caregiver and respite care, intergenerational activity, policy organization and communication, and also housing adaptation. So different kind of services offered by the target organization. So here you can see that most were in Greater Montreal area, as I mentioned, and also in Eastern Township in Sherbrooke and in Quebec City. So when we look at the general services, we see that they are mostly in the center, but there is also some in more rural area, like you see with the arrow over there. So targeted services seems to be really offered more in big center, but it also in some other region. But we see that there is a gap, and based on where you are living, you won't have access to the same services because those organizations are not the same. Here it doesn't different. It's another way to present it. It's a density without separating general organization versus target services organization. But it's basically, you can see that it's really Montreal, again, Sherbrooke or Eastern Township and Quebec that has the greatest density. So we cluster, as I mentioned, a bit differently. So home support and autonomy, we had a majority of organization within this cluster. Advocacy, aid and minority, activity pairing, and caregiver support or governance were with smaller number of organizations. This is a preliminary result. We basically reached 16 participants to those organizations, and you see who participated to our group, but they were representatives of those organizations, and we questioned them about what they need, in terms of challenge, what they face. And we are still analyzing the last group that we did, but it's basically, you can see that it was mostly women speaking French, from university degree education, and that were full-time employed. Their main challenges was about personalization of their services. So we direct people toward activity that will be in line with their issue and what they they would like to do. So sometimes they felt like the activity wasn't personalized based on the interests of the person. So this was one of the challenge. The transportation also was a puzzle for them in terms of, yes, you reach someone, but for example, you can offer transportation for medical reasons, but not when it's, and for also to do grocery or to go to the pharmacy, but when it's more visiting family and friends, this kind of transportation is not allowed. So it's not covered and offered. So this can create isolation. And in terms also of research, when I'm asked about research project, if it isn't an active component and concrete recommendation, I won't participate because we already know what are the problems. So basically they want to have research based on solution and how can we work together and build together things instead of know again what are the problems they already feel that they know. And of course, the funding was also another challenge. So reapplying to the funding, not being eligible to funding. So we did, as we began to work to really scan all the funding opportunity. Of course, the federal one, we have the same in BC and in Quebec, but the provincial and municipality one are specific to Quebec and to diverse region. For example, we have province have New Horizon for Senior program, but we have some foundations specific to Quebec, the program Québec Amis des Aînés, which is also help organization to build specific programs that target social participation. As Andrew mentioned, we did some of printable flyers or fact sheet, and you have an example here, but also in Quebec, we decided to launch a social media Instagram page which is called Gris en or, donc if I translate, but it's not, so it's gray in gold to highlight, to talk about aging and to highlight what we have been done in research and what is available in terms of data to also combat against ageism, to really raise awareness about there is a really different profile of older adult. There is no one profile of older adult, and this heterogeneity of a profile, we must know that and we must promote that to look that there is a really different way, different trajectoire of aging. So basically, I think this program leads to innovation through collaboration. And as Andrew mentioned, we have wonderful community organization that we are working with to really look at the gap in services for marginalized group. How can we adapt program or increase program to for those who are in needs and better meet their needs, of course. So it's really a call for action-oriented research. And we see some leverage that they have expertise in those organizations, and in research we have some expertise also in fundings and also access to knowledge around the world, so we can really build together a collaboration. So in conclusion, I think BC are more like a wide spectrum and specialized reach. In Quebec, more and more generalist focus maybe, and challenges in target intervention. And the next step is really to complete qualitative analysis, the rapid literature review, second wave of interviewing our organization to focus now on more, not what are the challenges and what they need, but more on what are the solutions and how can we build together innovative strategy. And this will co-produce and implement implement new intervention, hopefully, and will mobilize also knowledge. So thank you for your attention.
Some questions?
I'll ask a question.
Yeah.
Actually, for both of you. You talked about intervening and reaching out to find isolated seniors. What vehicles or methods that work for you to actually reach out to the individuals that are hiding in an apartment, they will come out?
That's a very good question. I'll start. I'm happy to start. The biggest challenge, and it's for anyone trying to address the area of social isolation and loneliness, is to reach those who are most isolated. And so how do you do that? There are a number of innovations, I think, that have been successful, but quite often they tend to be fairly simple ways. So some sort of an outreach program. You can knock on doors. You can use various kinds of semi-professionals, health professionals, pharmacists who can identify this. Melanie mentioned the Canadian Coalition of Seniors for Mental Health document that was released. You can find that online under the CCSMH website, and we produced recommendations for physicians, for the primary care physicians, and for allied health professionals to identify people, older adults with SIL, and then what can be done, and gave them very simple ways of asking questions and so on and so forth. And the next step that we're both on this committee as well is to work on some actual change methods. So I'm going around this in a difficult way because it is a huge challenge, and it's a very good question. But one other, I guess, anecdote is that when I was chair of the National Seniors Council, we were mandated to look at social isolation and loneliness. And this was back in around 2014 to 2017. We produced several reports with different recommendations. We have lots of reports with recommendations, that's great. But we did affect change in terms of getting New Horizons to have funding, multi-year funding, if an organization addressed the issue of SIL, so that was a good thing. But I remember we went around the country, and we went with the Minister Wong, who was in charge of that portfolio, and our committee. And when we were at Baycrest, you all know Baycrest in Toronto, it's kind of one of the gold standards. There was a knock at the door, because we met with organizations, and knock at the door, and an older adult said, "Can I speak to the committee?" And we said, "Yeah, sure." And this woman came in, and she said, "I just want to share with you my experience. I went through the Holocaust." She was in her 80s, well into her 80s, and she said, lost her husband, she became very depressed, she became isolated, she wouldn't go out of her apartment. And Baycrest had a very simple program where they would send around volunteers in pairs, and they'd knock on doors. Well, one pair went to her door, and they knocked on it, and she said, "Well, I've given up, she had suicide ideation, she didn't want to go on." And they spoke with her and said, "Well, listen, why don't you come by Baycrest, we have some programs." So she went, and when she came to see us, she was running the kiosk at Baycrest, and happy and feeling so much. So sometimes it's a small thing that can get somebody out, and sometimes we need bigger things. There's various technological innovations. There's the new Java Club, which is a structured peer support program for long-term care for community. Java Social. There's a range of kinds of programs. It's a huge spectrum, right? Some of the meals programs can bring people out. Sometimes, again, doctors, pharmacists, if they're frontline people and can recognize individuals. But this is the challenge, right? This is the challenge. And so there's not going to be one size that fits all. Long answer to
Thank you, Andrew, for that. Thank you for this question. In Quebec, we have a special initiative that was launched a few years ago. It's called Community Worker for Older Adults. It's basically people that get hired by a different kind of organization and reach out in various public places such as McDonald's, library or spaces where they can meet older adults and try to connect them to healthcare services. So this is our community organization services. So this is one thing that we are involved in terms of evaluating how this work is. Are we succeeding, reaching them and connecting them? But in Quaticook, we did in a small area in Sherbrooke, we did a benevolent community where we teach all public services workers, such as the grocery, the pharmacy, the library, to recognize when an older adult was diminishing in terms of capacity and really contact them with the community organization. So not only when you see risk of abuse or when you see a caregiver with burden, but also with decreased functional autonomy could be something that we want to think about. Of course, Meals on Wheels, firemen and policemen know some of those older adults that are difficult to reach, so we have to do more collaborative work with them. So I think it's about that.
And if I could just add, there's going to be a session on social prescribing. United Way is very much involved, and the community connectors that are being supported in the demonstration projects, I think, are very effective at connecting older adults experiencing isolation to various community resources. But again, I still think we're missing people, and that's why in our studies we have certain clusters. Ethnocultural cluster, some other clusters, LGBTQ. We have some clusters that are addressing the issues of specific marginalized older adults who are more vulnerable or high risk for social isolation and loneliness. But I think, having said that, I think we've got a long ways to go on this one. I think we have to change. I think we have to change the mentality at a cultural, societal level around aging, around ageism, around stigma, around elder abuse, all of those, all of the above, right? I think we really need a paradigm shift. And how do we do that? Opinion leaders, media, various report. We all have to do what we have to do. Everybody, students, you're the new next generation. The call is out there for you. The challenge is there. You need to step up and fill in these gaps.
Isabel.
Melanie, I'm curious, it's counterintuitive to me that in Quebec they are both less socially engaged and secondly want to be less socially engaged. That isn't what I thought the result would be. Any insights into why, and or in the data collection, any set of characteristics that are more or less attached to people who don't want to have more socialization?
Thank you for that question. We look carefully at the characteristic to see if there is more disability or more people living alone or some things like that could explain, but no clear explanation. When we look at what are the barriers to social participation, of course, people are really busy. They are engaged in a lot of things, so sometimes I think can be partially explained. Health problem also can partially explain, but there might be also a cultural difference in terms of how you have to engage in the community. Sometimes I hear things like, oh, I did participate all my life, now I'm retired, I deserve to to lay down and listen Netflix and things like that. So, but those kind of way of thinking could buy you a loss of autonomy. So we have to be really careful and promote why it's so important to participate socially. And before the pandemic, some decision maker in the healthcare system were telling me, yeah, you work on social activity, leisure activity. This is luxury. We don't arrive to give one bath a week to people that are in needs. And you talk to us about how can we get people out of their home and do some leisure and socialize, and they were like, no, it's not luxury. I mean, it's like breathing, it's like eating, it's like having a shelter. We are human beings, we need to socialize, but people before the pandemic were not in the mood to realize that. After the pandemic, they were like more sensibilized, aware of that, the importance, but still, it's a challenge to really recognize more. And we see that we teach people, okay, stop smoking, eat 7 vegetable and fruit per day, do some physical exercise, but we never talked about the importance of having a balanced life and doing some social activities. So this has to be more on a public health message in terms of the importance of social activity.
Okay, and there was one question here.
Thank you so much for this. So, Connect Age Project. What about all those community services that aren't in the 40 in BC or the 40 in Quebec? Because we're really suffering. How do you get in that crowd?
Join up. Well, we're still taking 1 or 2 organizations. because it's
Wow.
early in the
Leave
fall year,
your
so you should
phone
talk to
number.
me.
Yes.
But the third and fourth phases involve taking everything we're learning and coalescing even across the provinces to the extent that we can. There's going to be, of course, unique contexts as well. But we're going to bring forward, our findings and then share those with all organizations in BC. So the resources that we can create, we can make them accessible. Right now, only the 40 participating organizations in BC and those in Quebec are going to access the kind of resources we're developing because that's the nature of the study. But the dissemination phase can certainly allow for all organizations to access it, and maybe it'll affect change. And then in the fourth phase, part of it also is to affect political change. So for example, one of the things we're hearing a lot is, and I mentioned it earlier, is that funding is a huge issue for smaller, especially the smaller organizations. Year by year having to apply to those grants. And so we need to get more money. We have to allow more flexibility and longer funding structures that are more sustainable for small organizations. Otherwise, they come and go, wax and wane, and it's just a huge challenge for them.
Well, absolutely. Core funding, not year by year, where they ask you to do something above and beyond what you've ever done before. Do something new and novel, and we'll give you some money. But there's no core funding to keep you in existence so that you can do that thing that's over and above in the grant.
Excellent point, and just to segue, there are some organizations that we know about who are in municipalities that, while it isn't called core funding, there's a little piece of money that's always there. There's a pocket, and they know that there's that pocket, so they get that, but they need to supplement it with the other funding sources. Nevertheless, I think that's exactly what we need, is some core funding. And in fact, in Ontario, they just announced, about a month or 2 ago, core funding for neighborhood houses and senior centers. So, I mean, where are we, are we going to get this in BC? Well, I don't know. We need the political will. So, one thing we can do is start to use findings and the support of the organizations and going through major advocacy organizations like Costco and United Way, who, they're getting provincial funding, of course, but they get the ear of politicians. Hopefully it's the same politicians who are making the decisions over a period of time and not 4 years, but nevertheless, we have to get the messages out, and we have to support it. And if enough of us, squeaky wheel gets the grease. If there's enough of us saying, listen, we need some core funding, maybe we can see a little bit more of that. Right now, the funding seems to be going more to like United Way or other spotted kinds of funding. And that's not a bad thing, because they're doing some really innovative stuff, the social prescribing, some other, better at home, so on and so forth. That's coming from really provincial government and then some United Way money, I think. And correct me if I'm wrong, Laura and Bev, but, and Praj, but I know that they'll be speaking to some of this a little later in the conference.
Well, Please join me in thanking our speakers.
Thank you, Gloria.
And you probably have lots more questions that you can address to them while we have coffee break now for 15 minutes.